All right, it's on.
Okay, this is just to kind of demonstrate how we would normally go about getting up a real sick patient in acute care. And what we want to do is demonstrate why we would need some type of bedside sitting assist for their project, or why that would be important. So we're just going to kind of walk through what we normally would do. Okay, so the bed does move up and down, so I can use the bed to bring them up into sitting. But a lot of the time the patients are not able to help, and we don't need them just to sit up with their head up. We actually need their feet off of the bed so that they can get used to sitting at the bedside or sitting upright in a chair. So a lot of times they're so sick at the very beginning that sometimes just doing this is a lot for them to adjust to. They don't have the endurance and they don't have the overall stamina to tolerate being upright at the very beginning when they're so debilitated, like a stroke, a spinal cord injury patient, or somebody who's just been in the bed for a long period of time. That was easy. Would you go around the side and put the handrail up? So once I get them up into sitting, I can then help her get her legs off the bed. You're not going to help me very much. And I'm going to have to get her up. But then I'm kind of stuck because I don't want her to use the bed. And she has a tendency to want to fall, and it's hard to keep her upright because she can have balance issues, she could have fear of falling, she could be just really sick, she can have lots of reasons that she can't sit up on her own. So usually we bring a tech, or I have another person assist us so that we can actually do something therapeutic to help. So if I had something that I could wedge under her that would support her, I could eliminate having to use a tech and let her lean back some and work on coming forward and going back, coming forward, stop. I can let her work on holding herself up, so I don't really have to have arm support, or I could hold her, have her hold a knee, try and hold a knee. But if I had the back support, I wouldn't have to be trying to hold her here and hold her here while she's just trying to sit up. I could move her to a chair, but by the time I transferred her over to a chair, she's probably going to be too dizzy, faint, sickly, and I'd have to turn right around and transfer her back. So it's easier to work on sitting tolerance here at the bedside until they gain enough endurance and enough tolerance to be able to sit up for anywhere from 15, 20, 30 minutes at a time. So again, if the device allowed for a recline like that, I could work with her a lot on upper body stuff, pull, push me, push back, without having to have someone catch her. Or I wouldn't have to constantly be sitting here or sitting over here trying to make sure I could hold her up if I didn't have a tech with me to provide that second pair of hands. Also, if I had the device so that it reclined a little bit, I could release it if I had to put her down real quickly. If she got real sick, I could just get her back down in the bed real quickly if she couldn't tolerate it, so that she didn't faint or throw up or whatever.